Hello, everyone, and welcome. My name is Deborah, and I currently attend the graduate program of Grand Canyon University. Today, I will be discussing an example strategic plan that I have worked on for the class leading as a general manager. I'd like to talk to you a little bit about the reasons why I have chosen this strategic plan. It is to improve the overall efficiency, the performance, the quality assurance, and of course, employee satisfaction in regards to patient documentation. For the last 3 years, the stakeholders, which are all of the clinicians, the administrative staff, anyone that is involved with the patient, the owners, and myself, have gathered information, have researched diligently to see what would be the best form of documentation for not only our patients but for our employees as well, to reduce the burden of workload, to reduce fiscal burden of having missing accounts receivables due to late billing and past due billing, and then we would have to write it off. So there are many different things that we had looked at, and I want to thank you. All the surveys that we had sent out, you have all filled them out very honestly, and so we've been able to incorporate that into the program and to make the best possible decision. And so with that said, I am very pleased to announce that we have chosen our first electronic medical record system that was implemented in January of 2015, and it is called Point Click Care. Today's presentation, I will be going through some slides just to help you to understand a little bit more of what I'm speaking about. And so thank you again in advance, and let's begin. So again, let's talk about some strategic planning for patient documentation. We want to improve the communication and also improve the patient safety through electronic medical recording. This is going to be the strategic plan. So a little bit of background. The world of healthcare documentation has changed drastically, and just to help you to understand a little bit more, as we all know, we care for children from the ages of birth to 21, and when we get that phone call for a child in need, there are many different facets that come with that patient. There is the first sheet will be the referral intake sheet. With that said, there are many other pages of information, and a lot of times that can be lost within the shuffle of trying to have the patient admitted sooner than later if we have emergency placements that we need to incorporate. And so because of this, we have seen an urgency to have a centralized program that we can incorporate all of the data into one location where everyone can access this. And so, as I said, I'm pleased to announce the implementation of Point Click Care within our system. So the filtering concept of improving healthcare communication through electronic medical recording, leaders like the CEOs and the owners truly wanted to understand how is this going to help them? How is this going to reduce any fiscal burden? Well, first and foremost, the investment of this particular system from start to finish in the timeline is minuscule compared to the amount of non-reimbursed bills due to improper documentation or billing that just was not done correctly. And so with that said, this is really going to be a fantastic return on investment. The 3 years of research that we have done and all of the surveys that we have done, we really and truly wanted to be sure that this was something that we could all work on and have this system implemented into our program, not only for the existing staff members, but also for staff members to come in, have an easy, user-friendly environment that, as I said, can reduce the burden and the workload. And so let's just take a quick look. These are some fun slides. The before, paper form, patient documentation. I'm a nurse myself, and knowing what the documentation is like for a patient. We all know that if it was not documented, it was not done. So with that said, there are many different things that can go wrong. The result of this could be when there is a survey, an annual survey from state inspections come in. If you're missing one piece of documentation, well, that is actually a deficiency against the organization. And so with all of those pieces of paper, as you see in that one slide, it's not very far from the truth. We've actually been able to incorporate all of that data into one centralized location, as I mentioned, into point-click care. So with point-click care, patient documentation flows seamlessly from the core platform to portable devices. And what I mean by this is that a clinician, clinical liaisons, marketing representatives, off-site physicians can actually access patient information. They can monitor it, they can update it, they can print off from this, and they can send this off to another location, all from a mobile phone, an iPad, or a computer, as long as there's internet access. And of course, the goals for all this has been to improve the efficiency. So as I mentioned, there are many different pieces of information that we have incorporated and consolidated into one system. This is a whole bunch of data that you can see, and is quite messy, but the advanced directives, for one, change of status, emergency contacts code status. There is an entire packet that needs to be signed for consents that is 63 pages that is sent off to a parent or a caregiver that needs to be sent back. There's billing information. There might be a primary payer source, but there might be a secondary and a tertiary. There might be something where we incorporate where there is a dual parents and one parent has another, or a waiver form. There are many different things, as I had mentioned. Letters of medical necessity. Did we get that back? Did we get that signed? All of that can be found in point-click care by just a touch of a button. And so with point-click care, it'll really help the frontline team. And the frontline team members, as I'm speaking of, are the nurses, the nurse technicians, the physical therapist, the occupational therapy, the speech therapy, the program specialist, all the people that have the one-to-one care with the with the patient will be able to access all of this information just by a click of a button. So if they're doing a medication administration, let's just say, give that as an example, a nurse is going out to do her med pass. Well, sometimes when a patient is having a change in status, they need to have a little bit more time with that patient, obviously, if there's an emergency, or even if they just need a little bit more attention. As I said, being in the pediatric spectrum, we certainly want to be there. We want to have them have a home-like environment. A supervisor will be able to access on point-click care to see exactly where the med pass is. Is everyone on time? Is everyone receiving their meds on time? And that's not to say that that's micromanaging. It's not what our goal is. Our goal is to improve the patient quality of care. And so a supervisor can tap into this and say, oh, you know what, okay, somebody might need help, and they can jump in and start helping with the med pass. And so that, again, is going to be improving the overall efficiency. Reports, as I mentioned, they can be pulled off. For example, as a national marketer, there are times where I am in a completely different state. There might be a patient referral that we had received that is going to be sent to one of our Pennsylvania locations. And so I will be able to pull off a report and be able to discuss all that information with the case manager, with the primary care physician, maybe a subspecialty appointment as well. I'll be able to pull that. If there's an urgent lab or a different type of test that they like to have, I can pull that information and be able to exchange that with the other medical team out of state. As mentioned, point-click care is a centralized system. It enables the clinical team members to remotely monitor, update, print patient records, as I mentioned. It improves the communication. How many times have we been working on our own tasks, and at the end of the day, we forget and say, oh, you know what? I totally forgot to tell so and so on the next shift that this was occurring. Then you have to go back and you have to call them. Each and every task and each and every conversation, whether it is a psychosocial aspect of speaking with a family member, or if it's a new order, an old or a discontinued order, or a change in a med completely. This is all documented and real live time so that people can see things. You don't have to continuously go back. The data is there and the communication is better. People feel like they're more in the loop. And again, this is going to improve that patient safety and overall efficiency. And so the countdown begins. As I said, we are going to be implementing this on January 5th, the 2015. Change is good. This is going to be something that you are going to be thrilled about. We are going to have our trainers that are going to be on site. The first thing that we are going to be doing is sending out newsletters. We're going to have them at each of the sites where we will have them in the break rooms. We'll have banners. You will know this symbol so much you'll be dreaming about it. So when it's time for us to launch this, you are going to be absolutely ready. We're going to select team leaders, and this is from our own site so that everyone can kind of reach out to one another, and not just to the 24-hour IT support system of Point Click Care, but we'll have people that within our own realm that we can converse with and say, oh, you know what, I just put this patient information in and I forgot how to insert a new referral or an update or to look at a status. There is something called hospitalization update. And so when there are patients that are going to be in the hospital and you have the admissions coordinators that are going to be following up with them, or the clinical liaison, they can then access that hospital update and then they can document the real live time information. So with that said, I want to thank you all for your time, and I'm really looking forward for this implementation. Have a wonderful day.